Good morning, my name is Kimberly Dawn Kennedy, and today we're going to talk about whether physician-assisted suicide and euthanasia should be legalized. Brittany Maynard and Dr. Jack Kevorkian are famously known for supporting physician-assisted suicide and euthanasia in terminally ill patients. Dr. Kevorkian even went on record to say that dying is not a crime. Medical professionals choose to follow the Hippocratic Oath and agree to do no harm. But are we causing harm if we sit back and watch our patients suffer? Or are we doing harm if we assist them in ending their lives? If euthanasia were legalized, it would create a slippery slope for medical professionals that would only result in negative consequences. Euthanasia and physician-assisted suicide is ethnically wrong and should not be legalized. In most cultures, it's a sin to commit suicide no matter the circumstances. If euthanasia or physician-assisted suicide is what the patient chooses, then those left behind have to wonder how much longer they would have had with their loved one. They may have died in peace, but the family members and the loved ones that are left behind, do they actually get the proper closure? Euthanasia and physician-assisted suicide medications could cause the decisions of the patient and the family members to take a morbid turn due to the inexpensive medication, especially if the patient does not want to be a burden on their caretakers. The cost of the lethal medication should be increased and the cost of the medical treatment be lowered to be more affordable for all parties involved. Suicide should not appear to be the only option for the terminally ill patient. Murder is taking another human being's life, so how can we ethically say that physician-assisted suicide or euthanasia is not murder? Healthcare professionals are only taking an educated guess based on experience and evidence-based practice to predict the prognosis of a terminally ill patient. Some patients defy all odds and live well beyond their predicted time, and some patients have less time than they anticipated. So if they take the medication, does that mean that they're ending their life prematurely where we have had another 5 or 6 years with those patients? Terminal illnesses can also be unpredictable and may affect the body in different ways depending on the individual's age and lifestyle. For example, if someone is diagnosed with cancer at the age of 35, let's say that they were a marathon runner prior to that, their cancer may progress totally different than an 85-year-old who was diagnosed with the same exact cancer, because the much younger person is better at healing, their circulation is better, and they might respond to treatment a lot better than the elderly patient whose kidneys and liver is not functioning at full capacity. Physician-assisted suicide and euthanasia are ethically and morally wrong, as they send an overall message that murder and suicide are acceptable.